everybody. Welcome back to Ageless Anatomy Podcast. My name is Darcy. I am a certified laser technician here in Phoenix, Arizona.
And I am Brooke Vanguard. I am also a certified laser technician and educator and am a partner at Ageless Anatomy. Welcome back.
Welcome back.
So our episode today is on something that we feel is simple.
Right.
But it's not. Because
which
people
we feel it comes first nature to us, but to other people it may not. So,
it does.
Yeah.
And it shouldn't. It's
right.
You know, I've always said
you got to tell everybody what it is first. Pre and post care, everybody. Pre and post care for laser and procedures.
Yeah. Laser and procedures and why it's important to use the medical grade skincare that we suggest after.
Right.
Pre and post care is there's a few different ways. We can talk about some of the resurfacing and the deeper laser and pre and post care, as well as chemical peels in there. Anytime that you're taking that upper layer of tissue off. Why it's so important when we look at the pre, we don't want your skin to have been compromised. So if you were out, hopefully nobody's been laying out in the sun and spending all their money just doing laser because they're kind of swimming upstream.
Right.
So you want to stay out of the sun, no sun exposure. If you're just running around in and out of a grocery store or something like that, but for a good 2 weeks prior. Because or even tanning beds. I mean, some people still use tanning beds.
A lot of people use tanning beds.
Yeah. And
we have a client that lays in one every day.
Oh,
not going to mention names.
I don't even want to hear who it is. And even spray tans for some lasers. You want that to be, the spray tan even to be completely worn off, because some of those lasers will actually see that as pigment. One of the reasons why we ask you to have no sun exposure for a couple weeks prior, or to start using, make sure that you're using sunblock in those areas that are being treated. When you are out in direct sunlight, your tissue is, that's why it feels like that burn when you get inside, or even if you didn't get a sunburn and your skin it's fragile. Your skin has automatically gone into survival mode, like, oh, I've just been compromised by the sun, now I'm trying to heal. So if we go in with a laser and break it down again, it was already trying to heal, and now we've just confused everything.
Right.
And so we want you at the healthiest when you come in, your tissue at the healthiest when we're treating you, so that you get that quicker healing even. Right. So that's one reason. Your no waxing or other treatments within 2 weeks of that procedure. So if you're a client that is told, no, you can't have this treatment because you have to wait between, and then you go hopping to another facility, that's a real bad idea to layer things on top of it. You end up with contact dermatitis. So that's one reason why we don't like you hopping around. We want to make sure your treatments are the space between, which is normally 2 to 4 weeks for different type of treatments that we're doing. So that is on that post-care as well, or the pre. And then also to not be on antibiotics for certain types of laser treatments.
Yes.
Yep. Or sun-sensitive medication. So we go through that. If you have any sort of, if you have ever had a cold sore in your life, even if it was when you were a child, we like to know that, because we, Dr. Kane, pre-treats with a antiviral so that you don't get an outbreak with that heat.
Right.
Because that heat most likely would stimulate it. And then when we get into after you've had your treatments, there's some other things that we pre-treat with, depending on the ethnic background and things like that. We handle that in a consultation when you do your initial consultation. But then when we get to the toughest part is when we get to post.
Right.
I feel like
some just aren't compliant.
No.
Yeah. Or
And
they think they can use their own products that they have at home that they've,
Yeah.
We have specific products for specific lasers, specific ointments that go on after, and you can't just use Aquaphor. I mean, I know some people do use Aquaphor in their practices, but we don't recommend it at ours. So we have specific stuff that people, just helps the healing. It helps you heal faster. I mean, it's not like we're just trying to sell products to people. It actually helps the healing time.
And helps to reepithelialize that tissue so you're not susceptible to getting any sort of bacteria in there. The quicker you heal, the better.
Right.
So,
and it's even just cleansers too.
Yeah.
I mean, specific cleansers that have no active ingredients. That's the main thing that people just don't understand. It needs to be gentle. There needs to be nothing in it. No actives, no salicylics, glycolics. And a lot of these cleansers over the counter have those in it that people don't even realize that are in them. So, and that can just...
And I'll be honest, I don't. There are so many things that you can pull up to a drugstore and purchase now. I can't possibly know
what's in it.
What are the studies on those?
Right.
So there's a reason why we also use medical grade post-care product. And it's because it's been proven that it does what it does. And I will tell you, Darcy, that I had an experience about 20 years ago. And a client, I remember the treatment that it was. It was an E-matrix treatment. It was a radio frequency fractionalized, like ablative treatment. I had sold this client what she was supposed to use. She kind of gave me pushback on it at the desk. And I said, I cannot guarantee your treatment or your healing unless this is what you're using. I know what this is, and I know how it works with this service that you're getting today. And I know what I've done to your skin.
Right.
So she bought it. She went home. I don't think I've told you this story. She went home. She was swollen, of course, because that's normal. And she decided that she was going to use olive oil and honey. And she didn't want to open the product because she was planning on bringing it back. This is what she said to me. Olive oil and honey. So we have olive
I've
oil.
heard of Crisco. I haven't heard of oil and honey. That's crazy.
Crisco's fine. It's got a big molecule. Like, I'd rather have them use Crisco.
Right.
As long as it's fresh out of a can.
Right.
But,
honey.
And olive oil has more bacteria in it than anything around. So here we have a wide open wound. We're putting olive oil and occluding it with honey, apparently. I don't know. I'm not sure exactly. Like, maybe honey on not freshly wide open skin would be okay, but not with any of our treatments. So she knew that she hadn't used these products. So she didn't want to call the facility and talk with the medical director or myself. So she decided that she was going to go to the ER. So she went to the ER, and HIPAA laws kind of go out the door when they're trying to figure out what they're dealing with, right?
Right.
So the doctor was actually calling us, called the medical director. I was with a client at the time. Or no, I was not working that day. And he asked her 3 times. The first time, no, I've been using everything that they said after he found out what treatment I did on her. No, I was using everything that she gave me. And then he said, are you sure? Because he knew at this point exactly what I gave to her because
he had called.
But she didn't know he had called. And she said yes. And he said, okay, because I need to know in order to fix what's happening here. In order to treat you. And she said, okay, I used olive oil and honey. And I've been using that, but it says blah, blah. So she went into this whole thing. So he calls us back and says, oh, I know. On the 3rd time, she said she's using olive oil and honey. I'm going to give her a prescription because she's got an infection now. So
That's crazy.
You know, like, be honest.
Yeah.
I mean, do what there's a reason why we do give you what we do.
Yeah.
And so that was
to prevent it from you going in the hospital and having an infection all over your face.
Yep. Another situation is, you know, if you're not, excuse me, doing the steps that they cleansing AM and PM.
Right. Which is so important.
Excuse me.
So important.
It's so important. So if you're not doing those steps the way that we have it laid out for you, not your friend who came in for them.
Right.
You're different than your friend.
Right.
And we customize each one. I have seen where people just don't like the feel of when they're cleansing their skin, and so they decide, oh, I haven't been outside or anything, so I'm not going to cleanse it at night. I just cleanse it in the morning.
Right.
Okay, well, one of the reasons that we cleanse that skin off is each time you cleanse it, you don't see that upper layer coming off.
Right.
You don't see it peeling off.
Because it needs to come off.
But it's each time you cleanse it and rinse it, it's coming off. If you allow that tissue to build up on there, you will also end up with an infection.
Right.
It's like you have to just...
But you have to literally baby people, because when she's saying you want that skin to come off, you also don't want that skin to come off too soon.
early.
Because if it comes off too early, then you start the healing process all over again. You get contact dermatitis. It'll reepithelialize, seal back over, and then you start the whole healing process all over again.
Yeah.
So it's super important to gently cleanse how we tell you. We show everybody.
No washcloths, just your hands.
No exfoliants, no nothing. And we literally show people how to wash, how to put the product on. You're not scrubbing your face in any way. You're not rubbing the product on. You're patting it in. You're patting dry. So we literally walk people through step by step so that you don't end up in the hospital with an infection. You don't end up with contact dermatitis. You don't end up scarring after, you're trying to fix your scars. You're going to end up with more scars if you just don't comply.
And it is.
It's so easy, but yet people just, like you said, she did her own thing. She thought honey and olive oil would heal her faster.
Yeah. So I mean,
important.
Yeah, what we there's a reason behind what we do. It's not just that we, like Darcy said. I mean, it's not just that we're selling you these things for the heck of it.
Right.
And then also, we talk about post-care, but when clients ask how long their treatment is going to last, this is like the dental floss and the teeth brushing between your treatments is your product and what we specifically put you on.
And we always tell people the two of them go hand in hand.
Yeah.
Laser and medical grade skincare go hand in hand. I mean, you want to protect your investment, so it's so important to use the products that we recommend in between your treatments.
For your best outcome.
Right.
I mean, you can go off grid and do what you want, but like I said, I'm 57. I've been in this business for 30 years, and I've seen it. Yeah. I've seen people who are compliant, and I've seen people who are not.
Yeah.
And those clients who have been with us for a long time are compliant and stick with that skincare and really follow. They look amazing.
Yep.
Like you can tell a big difference. So between the two, and so we want you to have the best outcome because we've just done your service.
Right.
And
you're a reflection of
you're
of
a reflection of us. So that is the big reason why
so important.
We want you to be proud walking around, and we get we build our business on referrals, and there's a reason that it's that way, is because you keep that glow and your tissue really is healthy. So, and I will tell you that even just using medical grade skincare with the serums, and one of them is that TNS Advanced Skin Medica, it has actually been proven that if you are just using that, it reverses aging by 6 years. That's with no laser treatments at all. So imagine combining both. I mean, it works on a dermal level. So
well, we have two lines that we carry in the office. We have Skin Medica, we have Elastin. We use a lot of Elastin for our pre and post care. They have amazing products, Nectar, that we pre-treat people with. At least we like to do it at least a week prior to any laser. What it does is it helps break down that bad collagen so that new collagen can kind of come in and start growing better and faster. And their post-procedure Soothe and Protect is their ointment that we use. It's not Aquaphor. It's the consistency of an Aquaphor, but it is specifically made for laser treatments.
Healing and inflammation.
My favorite, I use all Elastin products. Their Restorative Skin Complex, which is their peptide, their vitamin C, and their hyaluronic acid are hands down my favorite. And of course, their Hydro Tint, which is their SPF, their tinted SPF.
Right.
You like Skin Medica. I have a love hate with Skin Medica. I love it for other people. It just doesn't do well on my skin. But the TNS Plus is probably the holy grail of all skincare.
Yeah. I mean, I use the TNS Recovery. I have since it first came out. When was that? Like the late 90s or something?
Yeah, probably. Was that before it was the double pump?
Yeah. Or no, that's the Recovery.
Complex. Okay.
Yeah, Recovery
that was out
Complex.
first, right?
Yeah.
Yeah. That's your fave.
Oh, yeah. But I mix mine. So I have my favorites if they ever. So I like that. And then I do use Elastin eye cream. I use the Elastin. I do use the Nectar sometimes at night, even when I'm not having a procedure done. And then I use the Elastin Retinol, the lower dose. And then, what else do I use?
I don't know. The vitamin C.
I use the HA and the vitamin C. Yeah, I use the entire lineup.
Yeah,
and I use the
Elastin.
neck cream as well. I kind of bounce back and forth between Skin Medica and Elastin on the neck creams. And then I do use the body of Elastin.
Yeah, the Transform Body.
Yeah, the Transform Body. Yeah, I use it all.
Yeah.
I mean, I'm older than a lot of them.
Not that much. Not that much.
And I just want to make sure all the bases are covered in case something in case they mix something wrong one time. No, I'm just kidding. No, but that is the one thing is that it is, I mean, there's been studies on it. And
right.
When you go to cosmetic counters at different department stores or drugstores, things like that, I mean, you never know what's in the bottle with that. And same with when people purchase on Amazon. I'm going to tell you, you don't know what's in the bottle of that, so I would not be buying your Skin Medica or anything else
or how
on
old
there.
It is.
Yeah.
They're old on there.
Yeah. We've had clients that made that mistake, so.
So we do have both product lines in the office, Elastin and Skin Medica. So we also have a shop tab on our website that you can click on, and it'll ship directly from Elastin or Skin Medica. I think they overnight it, no shipping charge. So you can shop that way as well. But like I said, we do have them in office, so you are always welcome to stop by and grab a product, talk to one of our providers. Someone's usually always there to chat with people. So
yep, do a little
shopping,
consultation,
a little skincare shopping.
Yeah, and we typically will have some different times. We have different samples in the office, and so we can also sample you and then follow up and see how you feel on certain things that you don't want to purchase at the time if you don't want to get the whole thing. Yeah. So, so that's what we suggest.
All right. Well, that's our skin pre and post care podcast for the day. So thank you for joining us. Hope you catch us next time.
Thank you, and we'll talk to you soon.
Thanks.